Good morning, sir.
Good morning.
Sir, with the goal of establishing the National Institute of Health and Family Welfare as a globally recognized institution in public health and family welfare management, it is quite evident that the institute has made significant strides since its inception. It would be helpful, sir, if you could provide further insights into the background and journey of the institute.
Uh, After independence, family planning initiatives were very important for India. In an institute of national level, National Institute of Family Planning was established in 60s in the country. Then it was realized that we also need an institute for health administration.
Right.
So, with these objectives, a national level institute, which was called National Institute of Health Administration and Education (NIHI), was established. Then it was realized that many of the goals and objectives of both these institutes are common. So it was decided in 1977 to merge these two institutes and create this national level institute, which is now National Institute of Health and Family Welfare. So it was created in 1977 by merger of two national level institutes, National Institute of Family Planning and National Institute of Health and Administration and Education. The main task of the institute was to uh, provide technical support to the government, to the country for rollout, implementation, monitoring, evaluation of various health related programs. And the institute has been providing capacity building, training, and planning evaluation for various national level health programs. Later on, it kept on expanding. Various other units were added to it. National Cold Chain and Vaccine Management Resource Center (NCCV-MRC) was added in year 2013, which is an apex body to provide technical and capacity building support to countries' immunization program. It is a joint initiative of Ministry of Health and Family Welfare, National Institute of Health and Family Welfare, and UNICEF. To begin with, it was supported with UNICEF, but now it is fully managed by NIHFW with support from Ministry of Health and Family Welfare. Then we had several other units like National Skills Lab, which is called Daksh, which provides skill-based training to the health professionals. Then we have Center for Health Informatics, which was established later in the institute, which supports all the IT-related initiatives of the Ministry of Health and Family Welfare. And then we have an online portal, Saksham, which provides online education to all the health professionals of the country, be it doctors or be it the peripheral level health professionals. So, since its inception, various other tasks, various other units have been added to NIHFW. So, really, it has now evolved into a, I would say, multitasking, multifaceted public health institute.
Thank you, sir. With this background, sir, how do you envision leveraging the multifaceted role that you have just explained of NIHFW as a think tank, catalyst, and innovator in the management of public health and related welfare programs?
So NIHFW, as I said, that has been as a think tank, it has been supporting the rollout, implementation of Government of India health programs, especially programs related to reproductive, child, maternal health. So the institute participated in a big way in rollout of RCH program, right from its planning, PIP, developing the modules, financial administration, need assessment, later on evaluation. So similarly for other health programs also the institute has participated, supported the government in the rollout. And as you know that health is a very important subject for the population or subject for the government. So the government will continue to come out with the new programs and our institute will continue to support, innovate, especially the training and capacity building of the people to support the national health programs. As a catalyst, the institute monitors implementation of the program, evaluates the program, and gives technical inputs to the government for any course correction or continuation of the same program. And we will continue to do that. And human resource management, that is training and capacity building of the professionals, because whenever we come out with a new program or changes in the existing program, we need to really train, build the capacity of the government health force. So that is a very important task, and now we have enough facilities, not only for the offline but also in the online mode, because when we have to serve the needs of the large health workforce of the country in a short time, we need to develop innovations in the education and training. So that all we'll continue to do. Apart from that, we have various educational programs like MD in health administration, we have diploma in health administration, we have postgraduate diploma in public health management, and we are coming out with the new courses like masters in public health and PhD in public health. So we are going to develop a good big uh, skilled public health workforce, which will serve as in the public health cadre of the country. And then we have participated in various research programs. We have developed patents related to some family planning methods, salt iodination in past, and currently also we are doing various kinds of researches, especially related to the cold chain management and immunization supply management. So we will continue and develop some more innovations to support the national program, especially related to health and family welfare.
Right, sir. So you're right, sir. Health is one, topic which touches the lives of every human being, and what the institute is doing is quite commendable because you can't have as many doctors. So training, is what the core activity, as you explained, is very critical in terms of creating that manpower workforce across the country. So yes, but how do you plan to enhance the institute's effectiveness in providing education, training, research evaluation, consultancy, advisory services, and specialized interventions through the interdisciplinary force which you have here at the institute?
I think it's very important that when you have to do something effectively, you have to catch up. You have to catch up with what is happening throughout the world, and you have to use the technology in a big
Right.
way. So what we are trying to build the capacity of our own people, our own say research staff, our faculty, our students, so that they are empowered with the recent innovations, whether it is related to research methods, whether it is related to scientific writing, related to the digital content creation, use of digital technology in health and education, and all the innovative techniques in education and technology. So we are conducting regular faculty development workshops to build the capacity of our own people, so that they are able to roll out their programs more effectively, more efficiently, and in a shorter time, catering to the as many number of people. And then regarding collaboration, interdisciplinary teams, so we are collaborating with the state institutes of health and family welfare. We are collaborating with similar public health institutes, and we are now trying to develop a public health consortium, which will include all the bodies which deal with the public health in the country. So if they come together, they can make a consortium, they can plan how to support the need of the country in a big way and serve their common objectives more efficiently. And so we are also developing in that way resource pool of trainers for which would be common to all the people, so that they can be uh, utilized by all the institutes. And we are also trying to, as I said, that we are having already a skill lab, but we are trying to expand that skill lab, so that not only the trainings, capacity building related to national health program, so we are able to impart the skill based training to the health workforce as well in a big way.
Okay, okay, that's great. So, what is the future that you envision for the institute in the domain of global public health?
I think institute has tremendous potential. So I would say my vision is that it should be a recognized public health university of global repute, and with a public health council as well, because currently we do not have a formal public health council which can regulate or which can give directions to all the public health training education which is happening in the country. So I see NIHFW as the public health institute or public health university of repute with a public health council which can regulate, direct all similar bodies, and which can coordinate all the public health related education and training in the country. And not only that, the institute, I also envision it as a global healthcare policy resource and management institute, because we are going to be a developed country. We have a vision to be a developed country by 2047. So we should not only serve to our country, we should show way to other countries, other similar countries to begin with, uh, so that we can provide directions, provide best practices, examples to the other countries as well. And then we can even become a leader in public health education and provide directions to the whole of world, including developed countries as well.
Right, sir. Oh, that's absolutely brilliant, sir. Thank you so much. And we certainly hope that your vision comes true for the Institute. And in the coming years, the Institute is able to contribute even more to bringing in better health professionals all over the country and, of course, globally as well. Thank you so much.